Well, good day. Welcome to the Brain Injury Alliance of Iowa webinar on COVID-19 and brain injury. What's the deal? My name is Jeffrey Lauer, and I serve as Executive Director of the Brain Injury Alliance of Iowa, as well as the Chair of the United States Brain Injury Alliance. A couple of disclosures to start. The content of this webinar was developed by the Brain Injury Alliance of Iowa, which is supported in part through the Brain Injury Services Program of the Department of Public Health at the state of Iowa. The content here is the sole responsibility of the Brain Injury Alliance of Iowa and does not represent the views of IDPH or the Department of Health and Human Services. Today, we're going to try to discuss, I'm going to hopefully discuss, some of the emerging and changing understandings of COVID-19 and some of the challenges with that, and some of the questions and concerns that people with brain injury, family members may have related to COVID-19. One more disclaimer, this is a general presentation in nature for information only and is not intended to be medical advice for anybody. It's not a substitute for professional medical advice or treatment or diagnosis. Please consult your doctor or other qualified healthcare provider if you have specific questions regarding a medical condition, brain injury, vaccinations for COVID, etc., or other procedures or treatments, regardless of whether they're prescription medications, over-the-counter medications, vitamin supplements, herbal alternatives. It's a complex area, and we'll try to give a little bit of an update here that might be helpful, we hope, for you to understand and ask better questions and consider what your response might be. So COVID-19 has challenged us all, not only in Iowa, but across the country and across the globe. It's not only been an interference with school, with work, with supply chains, with getting access to things like toilet paper last year. It's gone on a long time. We're in over 18 months now. We're about to crest into our third year of what's called the pandemic. And it's challenging to know what to believe or who to believe and what the trustworthiness is of changing information, sometimes conflicting and contradictory information that has political connotations, that has faith-based understandings and admonitions. And then in the face of mandates from local, state, and the federal government, and or the efforts to block or object to mandates, there's a great deal of passion and consternation and belief around this. So this is a challenging topic to take on, to think through and to navigate, both within many of our families, across the state and across the country. But I want to start with an old theory that just points out one of the challenges of trying to understand the changing nature of the COVID-19 information. Some hundreds of years ago, it was assumed that people got cavities and lost teeth because of worms that were inside their teeth eating them. It was known as the theory of worm decay. And it was actually based in some observations. When animal teeth were removed that had clear signs of decay, there were structures inside them that looked like they might have been worms. And so this wasn't just made up. It was people's best understanding and guess of what was going on. I doubt many of us still believe in the theory of worm decay. But what causes cavities? Well, I grew up in an era, and probably many of you did too, where we knew that sugar, or we were told that sugar, could help support bacteria that over time, with susceptible teeth, could cause cavities. And this is a framework for understanding currently what causes cavities, which is why there's a lot of suggestions for young people and all of us to brush our teeth regularly, because that will remove bacteria and decrease the frequency of cavities. In the arena of brain injury, COVID-19 and the science of COVID-19 across these areas, these are also moving targets, but they're moving much faster. So how people think about COVID-19 is impacted by science, and it can be impacted by medicine and the medical community. It can also be affected, as I mentioned, by social, political, and religious beliefs and convictions. So today, let me just go ahead and declare that we're using here at the Brain Injury Alliance some of the best information that we can find from what we consider trusted sources: the World Health Organization, the Centers for Disease Control and Prevention, the Iowa Department of Public Health, and medical professionals. So just understand that that's where this is coming from. So COVID-19, what is it? Well, according to the World Health Organization and the Centers for Disease Control and Prevention, and again, the vast majority of medical professionals, COVID-19 is a contagious disease caused by a virus. And the virus is known as the SARS-CoV-2 virus. This picture is often used by the CDC and others to point out that it's got a spiky structure. And I don't know whether these colors are the real colors or they're artificially enhanced, but it's a representation of a particle, a virus particle. So that's what we know about COVID-19. Most people with COVID-19 will have mild symptoms, but certainly some people can and have become severely ill. And more than 500,000 Americans have died from COVID-19. Most people with COVID-19 get better within weeks of illness. And again, some people experience longer-term post-COVID conditions. And post-COVID conditions are a wide range of either new, returning, or ongoing health problems that people can experience more than 4 weeks after being infected with the virus that causes COVID-19. So why are we talking about long COVID? Well, long COVID connects to brain injury in a couple of ways. Millions of Americans have been diagnosed with COVID-19 and have completely recovered. Somewhere between 40 and 100 million Americans, depending on what source one looks at, but that's still a lot of people. And a significant number of people who've had COVID-19 continue to experience after effects or longer term effects from having had this virus, this disease. Long COVID is estimated currently to afflict and to affect 10 to 30% of people who've had COVID-19. And those are people who've had either mild, moderate, or more severe symptoms from COVID. And common symptoms of long COVID include, but are not limited to, fatigue, cough, shortness of breath, muscle and joint pain, chest pain, and then a range of neurological components that include loss of taste and smell, difficulties in thinking or concentrating called brain fog. Many people call it brain fog, depression, anxiety, and changed or abnormal sleep patterns. So these symptoms, again, can occur even in people who've had mildly symptomatic COVID-19 illness. And if you're experiencing any of these symptoms after having had an infection with COVID-19, very much encourage you to contact your healthcare provider for more specific information about your situation. And we want to note that many providers, healthcare providers, have developed specific care plans to help support recovery from long COVID. The National Institutes of Health, in good news around this, have recently launched a new initiative to study long COVID known as persistent acute symptoms from COVID. It's an initiative that Congress has allocated over $1 billion in funds in the next 4 years to try to get a handle on long COVID related issues, how to prevent and how to treat long COVID symptoms. And again, with 40 to more than 100 million Americans believed to have been infected by COVID-19 by the end of 2020, we strongly believe, and we're seeing already, that 4 to 10 million people are living with long COVID, many of whom have brain injury related type symptoms, what we in the brain injury field are acknowledging are acquired brain injury symptoms. So a couple other questions have come up in the field about COVID-19 and brain injury. One is, can COVID cause a stroke? And the answer is yes, but it's very rare. In less than 1% of people who have COVID, it appears that there can be blood clots, which can lead to stroke. However, this has also been experienced by younger people, people as young as 30, and by those experiencing few or no other COVID symptoms. Like brain injury itself, which is different for every person. We say this in the brain injury field. If you know one person with a brain injury, you know one person with a brain injury, because brain injury is a unique constellation of issues for people who encounter it. I'm a family member. Many of you are either professionals or family members or individuals, and you know quite well that these are unique experiences that people who live with the chronic condition that comes after brain injury have. So the stroke component is variable but rare. Can COVID-19 increase the risk of developing Alzheimer's disease? Well, the relatively recent research has shown that in looking at the brains of people who've died from COVID-19, there are areas of inflammation, areas that look like they've had blood vessels that have leaked, and there are signs of mini strokes. We know that brain inflammation does put people at increased risk of developing Alzheimer's disease and other dementias. We also know or believe, because we've seen the patterns, that people who've had brain injury are at slightly or moderately increased risk of developing Alzheimer's disease or dementia. So one might assume that it would be prudent to try to avoid other insults to the brain, including second brain injuries or multiple brain injuries, as well as COVID-19, if somebody has had a brain injury. Which brings us to one of the last questions here. Can COVID-19 worsen brain injury or brain injury symptoms, or the challenges that people experience both short-term after brain injury and many years later? And the answer appears to be yes. COVID-19 can directly or indirectly induce or worsen the challenges after an acquired brain injury, which can be traumatic or from non-traumatic causes. So it could be from a car crash, from a fall, from a stroke, from other sources. Some of the damage from a traumatic brain injury after it happens is caused by the brain's own inflammatory response. And that both is designed by our immune systems to help protect us, but it also, if it gets overblown, can have a negative impact. It's been seen that a COVID-19 infection can cross into the brain and also cause inflammation in the brain, which can and could worsen brain injury. And so again, from a prevention standpoint, better to try to avoid, when possible, a COVID-19 infection. COVID-19 also seems to have an impact on human neurological function. And it can affect, but it doesn't always, and that's the challenge, it's variable. It can affect the supply of blood and oxygen to the brain, to brain neural tissue. And many of the effects of COVID-19 can disrupt a person's recovery from brain injury and intensify their symptoms. Just getting sick is not a good deal, but having the repercussions of COVID-19, which can affect a number of body systems, including, as we're talking about today, the brain, but also lungs and heart and kidneys and other bodily systems. So what to do? What to do is always the big question. And we're not going to tell you what to do. We're going to ask the question, should people with brain injury get vaccinated? Well, this is a controversial question in Iowa and across the country. About half the people in the country have had vaccinations. There are mandates that are coming out. There are frustrations and rejections of those mandates. But at the Brain Injury Alliance of Iowa, we would suggest that you might want to consider a vaccine to prevent you from getting COVID-19 or becoming seriously ill or dying from COVID-19, particularly if you or a family member has had a brain injury. Why is that? Because we believe it reduces the potential for secondary insults to the brain if it's already had one brain injury. Why else might you think about getting a vaccine? The vaccines have appear to be relatively safe compared to the impact on people who don't have them. Vaccines can help you from spreading the virus that causes COVID-19 to other people. And in addition, a COVID-19 vaccine might add you and others to the number of people in your community who are protected from getting COVID-19, even though at times some people get COVID-19 after vaccine. Those are rare events, we believe. But it makes it harder for the disease, it makes it harder for the disease to spread, and it helps reduce the community spread. And finally, it also helps reduce the chances that the virus itself, the COVID-19 virus, can spread and become more resistant to vaccines. There are some other things to consider as well. If you feel sick, you can get tested if you have symptoms of COVID-19. In Iowa, you can call 211 and be linked to a testing navigator, also a vaccine navigator. You can wear a mask, and masks decrease the transmission of COVID-19 between people, particularly if you're in a situation where you can't keep a reasonable distance between folks. There are a lot of beliefs, strong beliefs about masking. We're not here at the Brain Injury Alliance trying to tell you what to do, but it's strongly believed that wearing a mask in close quarters can reduce people's exposure to COVID-19. What other things are there to consider? Well, although COVID is not believed to spread intensively by touching surfaces or other areas, certainly washing your hands regularly or disinfecting is an option to reduce transmission. And if you're sick and there's a possibility that you may have been infected, it's good to stay home. It's better to stay home than to go to work or to go out and about. And then finally, it's still suggested by the Centers for Disease Control and Prevention to avoid crowded conditions with lots of people. We're all tired of the pandemic. We're all tired of not being able to go or having to think twice about going out. But those are some possibilities to consider. And for more information on COVID-19, you can look at the Department of Public Health, the Iowa Department of Public Health website. There's some links here that you can click through. Iowa State University and the University of Iowa have information on COVID-19, as do the Centers for Disease Control and Prevention. Let me go back to that. And then Test Iowa, which has access to free COVID-19 testing and how and where to get vaccinations, can be reached by calling 211. And finally, there are some references here that I put together just to let you know that didn't make stuff up. So you could look at these if you are interested. And then for more information, you can contact the Brain Injury Alliance of Iowa at 855-444-6443 or at biaia.org. So thank you very much. And we'll have a little bit more information about how to access our website and our COVID support group after this.